Today, we're sharing a story about Cindy, a challenging and difficult case, but one that is important to share with all of you. We met Cindy in 2024. Cindy lived with lifelong complex social, medical, and mental health conditions, including self harm and aggression towards others. Cindy spent time in our mental health and rehab units and presented as one of the most challenging cases I've encountered in my 36 years in healthcare. This is a situation where, despite all of our united efforts, our healthcare system was just not equipped and comprehensive enough to support Cindy's highly unique situation. During Cindy's time on IMRS, the team faced numerous challenges, mostly relating to her daily physical and verbal abuse, as well as aggression towards staff. The emotional and physical impact on our team was difficult to put into words. In recognition of this challenge, OSMH rallied. From team meetings, daily safety huddles, focused meetings with clinical teams and leadership, we went to extraordinary efforts to provide the best care with the resources at hand. From social work, behavioral supports, clinical leads, management, and senior team, we continued to problem solve ways to support Cindy in the best way possible. One of the strategies used was individualized care plans and coaching for staff safety. We didn't always get it right, but what we do know is OSMH leadership supported us through regular check-ins, which fostered genuine trust and connection with the team, as well as extra security presence and ethics reviews, just to name a few. Cindy's case has had a profound impact on
role. I knew and supported Cindy on multiple units. I was involved in her care since 2023. This allowed me to get to know Cindy well as a person and to see firsthand the multiple challenges that patients and staff face who have multifactorial needs and experiences. Cindy was one of the most unique patients I have ever worked with. Her life story was difficult and complex. Her ability to manage and cope with day-to-day life was also difficult and complex, including at the end of her life here at Soldiers. Cindy was a woman who continued to make her own choices, good and bad. At Soldiers, it was not Cindy's medical needs that were challenging to manage. It was her day-to-day choices and the risk that her unpredictable behaviors posed to staff that were difficult to manage. She was consistently inconsistent in her behaviors. Both myself and the BSA supported Cindy and staff to the best of our abilities initially with a behavioral care plan that included her likes and dislikes and tips and tricks when working with Cindy. However, this was later modified to be more of a safety care plan as Cindy's situation changed and legal considerations needed to be considered. Ultimately, it was determined by all medical professionals that Cindy's multiple care needs would be best met in the forensics and legal system. However, she didn't pose enough of a risk to society at large for this system to intervene and provided a place for Cindy to stay. And as a healthcare team, we were left to navigate uncharted waters here at Soldiers, at least from my perspective. What I did see was unwavering support from all levels of the organization, including managers, directors, and senior leadership. There was collaboration across the mental health care and medicine programs. This included active participation in meeting with frontline staff, supporting additional staffing, and meetings with regional partners on multiple occasions to determine the most appropriate place for Cindy to reside, while acknowledging that no place was ideal. I experienced true efforts through brainstorming with community leadership partners, including SGS or Specialized Geriatric Services, and their Waypoint leadership. Efforts and advice was provided from tertiary care partners such as Ontario Shores and North Bay Mental Health Services. Everyone was willing to give suggestions, but no one was able to provide concrete alternatives in a tertiary system rather than our acute care services systems. I observed Cindy's social worker go above and beyond to advocate with and for Cindy and navigate a legal system that was new to her as well. I watched Cindy's MRP continue to support Cindy in her wishes for autonomy and self-determination with respect to her medical and emotional needs on a daily basis. And I watched frontline staff struggle with personal biases and legitimate concerns for their safety, all while providing the best care possible and trying their best to support each other. While Cindy's story is not necessarily a feel-good story, Cindy is a patient I will never forget and for whom I saw collaboration and teamwork at play on a daily basis. Her story continues to inspire me to advocate for our patients and staff and for all to have the best experiences possible while working in an imperfect system.
I met Cindy in the summer of 2024 while she was an inpatient at Soldiers Memorial Hospital. I have been asked to share my view to help explain the challenges that our system faced with Cindy and the challenges Cindy faced with our system. First of all, if this is a story about Cindy, it is only right that I try my best to explain Cindy as a person. Cindy was a daughter, a wife, a sister, a mother, a grandmother, and a friend. Cindy was born in Oshawa, Ontario. She belonged to a church. She was married and had 2 daughters. She had a very devoted friend until her last days, whom she met in 1992 at church. And she worked various jobs throughout her life. Her biggest support was her friend, and our psychiatrist, Dr. Beller, who saw her on a regular basis, as well as many other psychiatrists since her teenage years. Cindy was very close to her mother, who passed away within the past 10 years. Cindy's psychiatric history started when she was 17 years old. Cindy had been a resident of many different women's shelters, group homes, assisted living facilities, and long-term care homes. She moved around from shelters to group homes to long-term care with many inpatient mental health hospital and tertiary center visits in between. Through the support of the people she encountered at these places, psychiatrists, social workers, behavioral workers, Cindy had ample opportunity to participate in treatment for her mental health. Although Cindy continued to struggle with her mental health, despite the many attempts at trying different mental health programs, inpatient stays, and psychiatrists. Cindy often had unprovoked and unpredictable violent outbursts that would lead to harm herself and others, not just in hospital, but wherever she may be living. The moral difficulties arose when Cindy would intentionally hurt others due to largely not being able to control her behavior stemming from her mental health. Cindy routinely would not engage in treatment. Therefore, there became a point in time when there was no specialized hospital or home for Cindy to be accepted to because of this. This left Cindy in acute care at Soldiers Memorial Hospital. Cindy spent her last days with her friend, who always saw Cindy as a person, a daughter, a wife, a sister, a mother, a grandmother, and a friend. Cindy's mental health was too complex for our province's healthcare system. Thank you for the opportunity to commemorate Cindy.